as well.
Okay. Dr. Elsa, are you here? Yeah. Hello. Good afternoon, everyone. Hope all are doing good after a busy morning session. Okay, I'm Namrita Kamath, the coordinator from AGA for this GTEC program. We have Dr. Madhapura Shashidhara, who will be giving us orientation on this GTEC program. Let me give you a small introduction about Dr. Madhapura Shashidhara. Dr. Madhapura Shashidhara is the Associate Specialist Anesthetic Allied and SAS tutor. He is the deputy lead for the Quality for MCH, MED and Global Medical Program, WWL NHS Foundation Trust, and also the honorary senior lecturer at Yale University. Thank you. Yeah, over to Dr. Shashidhara.
Right, thanks Namrita, and welcome to everyone and good afternoon. Just want to thank first and foremost thing is Namrita from Abhinava Global Academy, Mr. Vidyashankar and Vishal, who actually started taking over a lot of the things we want to do, and in fact without the Abhinava Global Academy support this program through the GTEC, it would not have been possible. So you would hear a lot more things because ultimately they are the ones who are holding your hands in India, supporting you for this under our guidance. So, and thank you. So I'm going to start sharing my screen. So I'll just confirm to me that you can see my screen as a.
Yes.
We can see.
Okay. Let me turn this. I think it's a YouTube which is on here. Right. So this is we've been associated with Manipal Academy Health Sciences and Manipal Nursing College, thanks to this MOU we signed in 2016. And we progressed quite well. We now, I can proudly say there are 9 nurses from Manipal who are now in some way or the other linked to GTEC. In fact, 3 of the nurses in the process of joining, 2 have already joined, another 4 are due to give some interview over the course of the next couple of months. This is purely due to the leadership and the support from Manipal Nursing College, Professor Elsa Devi, Professor Judith Narona, and previous Dean, Professor Anis George, with the support from the Manipal. I'm going to do a little bit of introduction about what we are doing from last year until 2025. We have a projection for what we want to achieve. So I'm just going to do that in terms of these lines. The first and foremost things I'm going to talk about the opportunity for the qualified nurses. Then I also said when we came to Manipal that we want to start supporting and helping nurses right from the year 2 onwards. So we have this Modular OET Coaching for nurses who qualified in the RST. I'm going to talk about that. So that is purely in terms of supporting English, but we also want to go a little bit further in terms of our memorandum of understanding, using our facilities with the Abhinava Global Academy. Through them, we want to deliver some sessions using our nursing educators and Global Training Education Center and various different NHS trusts to deliver some sessions to meet the Indian Nursing Council syllabus or whatever is required for each nursing institute. And also talk a little bit about alternative week, bite-sizing, general English class and other things. So that's what I'm going to talk about. So the first thing I'm going to talk about is for the qualified nurses, which is the plan A. So we intend to do some campus interview in January, February, and March. Obviously, this plan was put in place before this South African variant, Omicron, came in. So we had to rethink our dates. I think we're still hoping that we will do something in February or March. So I'm hoping that both Elsa and Sweetie Fernandez, who's in this, and Professor Judith Narona would be able to support us for coming and doing some interviews in Manipal Nursing College campus. So what we are going to do in that interview is for those people who already got the either IELTS or OET would be wanting to do an interview on site and give them a job offer to join GTEC. So we don't necessarily need to wait. So we will be able to do that. So we will be bringing all our HR people, other people to come. We can do all the things just like the campus interview. People who are successful in campus interview would be given a job offer. That's what we need to do in March. So essentially, we have created opportunity for 200 nurses to join NHS before March 2022, and about 1,500 by the end of year 2024. So obviously, there are some essential criteria. So they have to either pass OET or ALTS. I'll show you the eligibility scores in the next one. They should have an approved BSc or any nursing qualification, so long as it is registered with the state nursing council, that will be fine. And people should be willing to join the NHS. We are now extended. We managed to get some extension into this. Previously, if you remember, when we came first time, we were only able to offer jobs in opportunity for training in adult nursing. Now we are extending to maternity, mental health, and pediatrics. And one of the questions the Vice Chancellor asked me is about what will you do for other specialties. So we're going to start some pilot around people who have done BSc in anesthesia and theatre technology, now extending further into physiotherapy, other things later in the year. So we're going to start with the BSc when we come in March, see whether we can do something around that. I'm just going to check. Yeah, there's nothing in this chat. So going further, so just to give you a little bit of hint about what is it, obviously we'll be able to send you this information. Abhinama Global Academy has all the information available for you. Essentially, we either need a OET or IELTS. The scoring is as listed there. Writing, they can get 6.5. They can actually combine two tests, and combining the two tests within 6 months is allowed. However, they should not drop the score less than 6.5 in any module in each, except the writing, which they can drop it up to 6 in one of them. That's why they're doing it. So similar kind of arrangement for OET. We prefer OET for the reason that it does offer nurses better opportunities in terms of going quickly, because OET is more related to nursing sciences, medical sciences. We have seen people who have done OET seems to progress far more quickly, able to achieve things far more quickly. That's a big significant advantage of people doing the OET. The plan B. So we also, when we come to do the campus interview, these are some things we want to do. We want to meet some of the qualified nurses, meet qualified nurses, year 4 nurses, postgraduate nurses. So we also aim to meet some ICU anesthesia nurses. So we actually set the date at 24th of January, and also to come to money from between 28th to 1st of February. We're going to relook at that dates, and we'll commit some new dates. And we will offer some more information about direct recruitment if people were done, and also in terms of giving some information about OET coaching, which I'm going to do it today as well. So that's one bit where I'm talking about the people who are already qualified, who are already nearing the exam, who have done the exam, this one. But the second part is for the students, nurses, the plan C. So obviously I'm going to talk a little bit about the qualification, who can join the English coaching, which is the first step in getting into the NHS. So Abhinava Global Academy will deliver rapid screening test for all the nurses. Those who score more than 300 would potentially will qualify. When they qualify, they will need to register and enroll into the course, and by signing a student learning agreement and paying 10,000 rupees. That 10,000 rupees will be enough for them to go through the coaching. There's a one-off fee, and that fee will be refunded when they join the NHS. So it is fee which you pay. It is to show that your commitment. If you join the NHS, they will get that money back. So you're not keeping that money. So for the people who are in year 2 and year 4, early part of the year 4, if they have a score of more than 300, we would recommend them to go into a 12 to 18 months coaching, because that is the amount of time they require to reach a score of 500 above, enough to pass the OET exam. Okay. So year 4, towards those of you who are near the exam, 6 months to the exam, or who have done PBSc or MSc, they have a score between 400 to 469. We would recommend them to join 6 months course. And year 4, those who are doing the exam, if you got a score of more than 470, I think 16-week course would be reasonable for you to get it. So those who are score less than 300, you will get English classes free. Apologies to everyone. I just need to go to the door. I think there's a postman with a post for me. Sorry, apologies. Apologies to everyone. Sorry. Right, where was I? So those who score less than 300, there's a bite such English class which is free. Come to that in a second. Just to go further, I think I've already covered this. Year 4, we have less than 6 months to the exam, score of 470 and above. So obviously, this is a 16-week course, quite intense course. So essentially 1 hour class, 3 days a week, Monday to Thursday. In addition to the bite-sized English class, it is a OET course rather than IELTS. We don't do IELTS anymore. We have stopped. And NHS prefers the OET nowadays because of the nurses are far more trained in terms of their communication, in terms of managing the patients. If you want IELTS, I'm afraid we won't be able to provide that. If you have somebody who has done an OET before, have issues with one of the sessions, we can consider them for a little bit aggressive course for them, which is a 4-week course. But this is what we're going to do. We take up to 15 students per class. Obviously, more students, as soon as we get people enrolled, then we can start those classes. This is for year 4, more than 6 months exam, but you got 400 to 469 score. So you go to the 6 months course. This is a 6 months preparatory course where you need to attend 2 days a week, 1 hour lessons per day. And those students, this is something which I want to propose to the nursing college, where we are now ready to offer these classes to year 2 onwards. Obviously, they have to have a score of more than 300. The simple reason is anybody who scored less than 300, the realistic chance of passing is quite difficult. However, we can support with the bite-sized English class and keep reassessing them. If they do get a score more than 300, we can get them into these classes. So that's about the English in nutshell, what we're going to do. But I'll come back to how you can get into these English courses. In addition to this, we are now in a position to offer these specialist specific sessions through Abhinava Global Academy. Abhinava Global Academy will facilitate this, but the people who are going to be doing these sessions will be from various different trusts, the nursing educators. We offer 1 to 2 hours a week, 1 or more nursing institutes, so it can be Manipal, it's other places as well. Topics of their expertise are something which you suggest in the syllabus, which is relevant. I will make sure that I'll find somebody suitable. So quite happy to meet, discuss, come into some kind of alignment about what needs to be done. Even if it is needs that you need some expert speaker for a conference or something, so we are able to provide that now. It is another profile building exercise for your institute as well as NHS and obviously Abhinava Global Academy. That's what we are trying to do. I did say the nurses who score less than 300, we want to do something about it. So this is what we are planning to do. Bite-sized general English class, alternative weeks. Friday is the best time for us. So I need to agree with the time with obviously, we will agree the time with AG and GTEC, but obviously with Professor Judith Narona, Elsa and Sweetie Fernandez, what time is good? What time can you timetable this? This will be free. This can be delivered in your education center or through our own streaming network, which will be provided by Abhinava. They will be able to do that. We can have a combination of English and combination of some specialty specific classes as well within that. If it is a topic which will have a greater importance for all the nurses, we can do that. So for example, something around patient safety, we want to start from talking about right from the year 2, we can do that. In addition, we have instructed Abhinava Global Academy to help delivering some education activity support of the GTEC. Other things, so some workshop, anything for that matter, we can do that. Essentially, I need some kind of agreement in terms of the day and time, Monday to Friday for the English classes, Friday for the bite-sized general English class, Monday to Friday for the specialty specific classes for the syllabus. We can do some weekend, not regularly, because I can't necessarily get local people here to come and do it on the weekend. Certainly the English can sometime be delivered, not as regular. If we need, we can do that. So this is just a very simple journey of a nurse from the Manipur to join GTEC. Student joins my BSc nursing course, aspire to join the NHS, want to improve international English and career progression development, do a rapid assessment test, join the GTEC English coaching, pass the OET. Deliberately, we're not doing the English coaching, even if somebody is year 2 or year 3 scores more than 470. Not putting them to section meet because the OET is only valid for 2 years. So we'll still advise them to join the basic English class first. Job offer, free arrival support, travel to UK, ASCII training and examination. This is our initial steps. Hopefully by the end of year 2022, if we progress these things successfully, we may be able to consider ASCII training along with the campus interviews in Manipur. So similar thing for the qualified nurses. So obviously the next step is to register with Abhinav Global Academy. 40 minutes rapid screening test. For those of you who have not done it, achieve a target score of 300 plus, then we will put you into approximate classes. Namrita and from the Abhinav Global Academy will be able to send you some links to this rapid screening test application, how to do that, what the procedure is. And they will send you the link about how to take an English score test with a real life example video will be shared by the Abhinav Global Academy. They'll be able to provide some question answer. I think the frequent asked questions have already been developed by Abhinav Global Academy, and they will also support you with anything to do with the English score application. I think I've already covered this. So important thing, just to remind you again, register with Manipal Nursing College and Abhinav Global Academy. So you need to put in the application where you're coming from. You need to make sure that you're coming from Mahe. Then when you finish, then we'll be able to put you into the coaching. That's the form which you need to sign once you finish your English exam. Once you finish your screening test, if you get qualified, you'll be expected to sign this student learning agreement, which will send it to you. I think I'm going to stop at that and take some questions. Thank you. I hope all of you heard that. I hope all of you, it was clear to you. Elsa, are you okay? So.
Yes, yes, yeah, okay. We need to, sir, we need to look at what timing of the day, because as long as the students are in the classroom, evening a particular time is fine, but otherwise they may start going for morning and evening shift. So we need to decide carefully on the timing of the classes, and especially for those 16 weeks and 6 months course. And whereas the other English classes that goes on, I think that we can put up in the timetable itself.
Right. So what you need to happen is, Elsa, is people who have done more than 300 scores, we can we actually have to divide them into groups of 15. Once we get the first 15, we can get start. So what we can do is, as soon as we get the first 15, we can start one, and we work on that in terms of. So
Only
you
one.
do understand the requirements of the timing. So obviously, because we are 9 hours back in UK, we should be able to do most
Your
of the class.
afternoon and our evening, because the students could be in the clinical till 7 p.m. And so it will be wise for us to give them at least another 1 hour to reach back home, and then we have it. So maybe your late afternoon and our evening, late evening, I think should be a better time for the 16 weeks that they know those who got good score and wanting to push off early. So I think that will be the best. And for other classes, lower classes, the English classes, we will put in the timetable, because we have few hours of, we have already put a value added and so many things. So we can still space somewhere, and then we can put up regularly. But for the people who are doing 16 weeks and 6 months, I think we need to have special consideration to do in the evening, late evening.
So what I suggest is, Elsa, either you or anybody from the nursing college, if you can make a regular meeting with me and make an action plan about when we can start doing this. Because
But only the student have to register. So it all depends on the students registering, and then we can start planning for it, because hardly I can see 2 or 3 registering. So
yeah,
at least
also
15
once the
people
students
to register, we
register, we
could
also
begin with.
need to think about how we are going to do this, because uh, we have been doing this planning and we're not been able to put into action, isn't it? So obviously we
Only
need to put
registration is
it
pending, sir.
together.
That's the reason.
Yeah.
So if I get an update from the Abhinava group regarding how many people have registered across, and then we can plan the time to visit. That's what we are planning.
Right. Namrita, why don't you have a regular meeting with Elsa and keep me informed of the progress, how things are developing? So we can do that, yeah.
We will do that.
Vijay, your network is not great, Vijay.
In one
Sir,
of
your
the
voice
they
is
are in touch with
breaking.
Professor Elsa for, and Professor Elsa is always in the Mahesh perspective. Okay. Okay. So okay,
Turn
I
off your
was
video, Vijay.
just saying that, like, we will coordinate with Professor Elsa and keep
Vidya sir,
I did that. I think
you
still
mute
my
your
network is low.
video. Yeah, then so you can put off your video so that your network is better.
I have done that, but still my network is low. I'll just put that in the chat box right away.
Okay, thanks, Vijay. Vishal, any questions on the YouTube? I can't see any. So any other questions from anyone?
Actually, there is nothing compared to live session. If you were all here, it would have been so good. Because when you have YouTube and things like that, the response becomes a little more faint.
There are 22 on the YouTube. I don't think there are any questions there. Okay. Just put a message on the YouTube to see any questions. I can't see any. Any question from the group here? Anybody? Quite happy to unmute yourself.
So there are no questions on the chat
Right.
box.
If you compelled to join the MAHE for experience, can we join somewhere else? Okay. Joel George, you don't need to join MAHE for experience. Only thing is when the lot of institutes, when we're looking for 6 months experience, don't necessarily give you the experience certificate, which is a bit unfair. But if you can get that, that's fine. Otherwise, it's always been very useful to have the MAHE contact through ELSA and Switchifanan and other people. They are able to support the nurses in terms of getting the experience, the references. So the answer to your question is you don't need to. You can join outside MAHE. I'm sure a lot of you have come from distant places to do the nursing course and you want to go back to your hometown and to get experience near your home. Yeah, absolutely fine. No issues with that. Anything else? Anybody else? I'm quite happy for people to unmute themselves and ask a question if they have any. Madam Sweetie Fernandez, how are you? How are you doing? Have you got any questions for me?
Good afternoon, sir.
Hi, how are you?
I'm good, sir. How are you, sir?
Oh, very good, very good. Thank you. I know. Despite this new strain, we're okay. Life has to go on, isn't it? This has been going on for
sir.
some time.
Yes, sir.
Because I said we want to start coming and doing some campus interviews, but we still want to come. That's something which we want to do is we get enough people. They want to come and do some campus interviews, Manipal. Provided you guys
You are
are
most
going to
welcome,
support
sir.
us. Yeah. Well, obviously, we need the numbers, isn't it?
Yes,
What
sir.
the first question they are going to ask our HR, the finance is going to do, how many nurses you're going to interview and how many people are there to go, because it's easy for me to come and Raj because we are coming to the doctor's interview as well. And to bring the nurses to the interview and other people, they'll always ask. So see what happens. I'm optimistic that we'll have enough nurses to interview. It doesn't, we can use a MAHE campus to interview nurses
Yes, sir.
in the near places who are qualified. So
Yes, sir. Yes, sir. There are lots. There are lots.
Bangalore, Calicut, all the way, northern Kerala and across the Karnataka, anybody who can get to Manipal for the interview, we are happy to do the interviews.
We will
Idea
coordinate,
is to,
sir. We will coordinate.
yeah, idea is to interview and give them offer on the day. That's what we want to do. Right, if there are no other questions, I'm going to say thank you very much. Again, thanks Namrita and thank Vidya. And you guys have been doing very well. Please coordinate with Elsa and Sweetie Fernandez and Mahe. And get an action plan going.
Sure.
We need to start getting people on seats for the classes to start. We are ready. Oh, Elsa, I didn't tell you that we got 2 more English teachers.
Oh, that's great.
Because we are actually got enough capacity to do more. So we can run, from January, we can have 2 classes, each with 15. Multiple classes, we can do up to 5 classes, 5 plus 10 classes in a day. We can do that. Okay. And also,
thank you so much.
Also think about your, can you take it to the specialist specific sessions for your nursing curriculum? It may be a good idea to start getting some topics out. Anything we can support you. And get rid of the virus so that you can also come to us.
this virus is too much, sir. Now we have new rules and regulations coming in.
Mm. Okay,
Virus is not leaving us.
thank you.
Well, some
I know.
Yes, Vidya, sir.
thank you, sweetie ma'am. Thank you so much.
Thank you,
Okay.
sir.
Right. See you all. Thank you very much.
Thank you, Sashi,
Thank you, sir.
Thank you so much.
Yeah, thank you, everybody. Thank
Thank
you,
you,
Elsa.
Namrita.
and
Thank
Vidya,
you.
just
Pardon
Namrita
me?
and Vidya, if you can stay back.